A dermatome is an area of skin supplied by nerves from a single spinal root.
And a myotome is a group of muscles that a single spinal nerve innervates. C1 to C3 is cervical flexion, which is also known as your neck area. C4 is the posterior view of your shoulder. C5 is shoulder abduction. C6 and C7 is elbow flexion and extension. C8 is thumb extension, and then T1 is finger abduction.
As you're going down the body, the best way to remember this is
Neck, shoulders, elbows, thumbs, elbows, thumbs.
The best way to remember this, continuing to go down the body, is hips and knees and
ankles and toes. Hips, knees, ankle, toes, ankle, toes. When testing to see if the C1 and C2 myotomes are injured, the best way to test this is to flex your neck up and down, and if there's pain, then there's most likely an indicated injury.
Okay, the next test is rolling your neck side to side, and if there's any pain, then this indicates an injury to the C3 myotome. The next test is a scapular retraction test, which tests the arm strength of the person. If the doctor will push down on the arm, and if there's any pain, then this indicates an injury to the C4 myotome. No pain.
One of the most commonly used tests to test the C5 myotomes is to flex the elbow at 90 degrees, then offer gradual resistance when trying to abduct the elbow. Okay.
C6 innervates the most powerful wrist extensors, which do radial extension. To test for this, stabilize the patient's forearm and have them do wrist extension. If there's any pain, this indicates an injury to the C6 area.
There we go. C7 is mainly responsible for elbow extension. A common test for this is to fully flex the arm, offering constant resistance until the patient can't receive anymore. Ow.
The C8 myotome is used to test finger flexion, and the doctor puts force on the patient's fingers so that they cannot perform flexion. If there is a problem, then there is something wrong within the C8 area. It hurts.
T1 is mainly responsible for finger adduction. So when testing for finger adduction, the best thing to do is ask the patient to extend his or her fingers out and holding a piece of paper in between the two fingers. And then all they have to do is pull as hard as they can. And if there's any pain in between, then there's most likely an injury.
L3 is to do knee extension, and if you're just going to provide resistance so that the patient can extend their knee. If there is any pain, then this indicates an injury to the L3 structure.
Okay.
Ow.
L4 tests for plantar and dorsiflexion. The best way to do this is to instruct the patient to dorsiflex and invert their foot with your free hand. Hold the patient's foot and ask them to resist your attempt to move the foot. Okay.
L5 tests big toe flexion, and to do this, you can do a heel walk. And if there's any pain during this heel walk, then there is an injury within the L5 structure, and your toes cannot touch the ground in the heel walk.
The best way to test S1 is to get a resistance band and then avert your foot outwards. And if there's any pain running from your toe to ankle, then there's most likely an injury.
S2 tests knee flexion, and to test this, the patient must lie on the ground on their back and bring their heel to their butt. And if there's any pain, that this indicates that something is wrong with S2.
Okay. L1 and L2 both test for hip flexor, so the best way to do this is have the patient lie on the ground and sit in a seated butterfly position and have them lean forward and to the sides. If there's any pain in your hip flexors, then there's most likely an injury. I'm just gonna have them lean forward.
Ow, my hips hurt. The best way to remember the 12 cranial nerves are
Ollie Orange Overton takes the apple from Violet, giving Violet angry hiccups.